Hello, friends. Welcome to today's live. I wanted to take a moment to discuss really quick the Michigan. I'm going to say Michigan a lot. I'm from Michigan, or I've lived in Michigan. I lived in Michigan. We're off to a really good start. I lived in Michigan for a really long time, so I can't say Minnesota Nurses Association without saying Michigan. It's a personal problem. But we're going to be talking about the Minnesota Nurses Association and how they are going on strike tomorrow for 3 days, why they're going on strike. And then we're going to read some sassy emails and play some gaslighting bingo from some things that happened to accidentally fall into my inbox that may or may not be some of the hospital admins emailing the staff. From these places. We're going to talk about why you should go and support the Minnesota Nurses Association. I will have oodles of links listed down below of things that you can go check out and just get a good vibe of like what is happening. And we're going to support them by just kind of spreading the news because there's going to be a lot of people who wake up and decide that they're villains and are going to try to spread some crappy things about the Minnesota Nurses Association and say like, oh, I can't believe you're doing this by abandoning your patients. And we're going to squash all that and say, we're not spinning that narrative. And we just need a lot of people out there to support it and like let everyone know that we support the Minnesota nurses who are doing this because it sucks for the patients. It sucks for the nurses. It sucks for the hospital, but they're doing it for a good cause to try to make things safer overall. If you're watching this on the replay, I will at some point have timestamps up at some point. And if you're here live, hello. I see oodles of our regulars. I'm so sorry I'm late. I'm late every time, but today's reason is that first of all, I am cooking like 8 billion things. And if you know me, I don't like to cook, but my cousin and his wife just had a baby. And I am making them a bunch of food because I remember how much I hated having a newborn, like so much. And I was so overwhelmed. And the last thing I wanted to do was cook my own food. And I was literally like existing off of granola bars and PB&J. So I hardcore project now when people have babies. And I'm like, I can't really do anything for you, but I'll feed you. So I'm like cooking all 7 recipes that I know how to cook downstairs in my kitchen. It's halfway through. And then I logged in and all of the things that I had to go on top of my stream were gone. So I was like, oh my goodness. Mama Nurse, hello. Teresa, Chicken Maddie. I watched you since nursing school and I was working as a COVID nurse, cardiology now, and a PIC nurse from Ohio. Oh, hello. That's super sweet. Sophia, hello. Thank you for being a channel member. I appreciate you. Marie Brick, first time. Hi, all. First time live here. Oh, well, welcome. I'm glad you're here. Jack, we have all sorts of people here. How is our weekend going? It is mine was really good. I went to like some kind of a festival thing with my children yesterday. I'm exhausted. I'm like, how do people do this? Underpaid nurse, hello. Thank you for also being a channel member. I appreciate you. I made it. It's like she finally made it. Yes. It's one of those features of the channel that we're just late and we ramble a minute in the beginning. So hopefully that doesn't, well, if you don't like it, you may want to divert elsewhere, but I appreciate all of you who are here. Mr. Midwife, hello. That's Chad, if you remember. Rogan P, hello. Thank you for being a channel member. I appreciate you. Hi, Liz. They went on strike. They're going on strike tomorrow. Tuesday and Wednesday. So 3 days they're planning on going on strike. I am doing this live tonight because I wanted to see if they were going to maybe change their mind. Like if they've been negotiating all weekend, and they were going to have like a rally, which they're having tonight. They already had it, I'm sure. I was going to see if they came to any conclusions together. It looks like they did not. And they are going forth and having their strike tomorrow. So clearly nothing got resolved. Kim, hello. It was the weekend, underpaid nurse. It was the weekend. That's how I feel all the time. I'm like, wait, what day is it? Especially since I work from home. I'm like, I have no concept of time, but now my littles are starting preschool this week. So now I will have to have a concept of time because some days I send both and some days I only send one and some days I'm at home with them all day. And I really should keep those straight instead of like dropping both of them off. That might not be great. CK Medic, hello. Thanks for being a channel member as well. I appreciate you. Montana Gal. Oh, everybody's here. Kim is supposed to be writing a 2,000-word nursing informatics essay right now. That sounds like hell. I'm so sorry. Absolutely awful. Okay. So shall we take a look at just what's going on. Um, we'll just get a vibe of what's going on. We'll meet the villain because we always have to have a good villain in the situation. If you have any questions, I probably can't answer them. Feel free to leave them in the chat. Maybe someone else will be. We have a lot of Mama Nurse usually knows like everything. Chad knows a ton. Underpaid Nurse usually has excellent insight. So all of these people, great insight. So you might just ask the chat. I probably don't even have the answer. Let me look or feel comments or anything like that. Also, I do have a video that goes over the whole process of like the strike, what a union kind of is, all of that from my research of it and my experience being in a union. I only ever was in a, like, I've only ever worked as a nurse in a union. As a nurse practitioner, I was not in one. And, but as a nurse, I was. So I have a whole video on that. I will leave it linked down below. Did I do that ahead of time? No. Was that to trap you here? Maybe. Anyway, if you're watching it on the replay, you're not trapped. You can leave whenever you would like. Everyone who's here live, obviously, you're trapped. All right. Breaking news. All right. Breaking news. It's no longer breaking. On September 1st, the Minnesota Nurses Association did announce that the strike that they authorized, so all the nurses in the Minnesota Nurses Association that are in these hospitals, this group of hospitals, had decided, hey, if it comes to it, basically the background is they're trying to get a different contract. So when you work at a union hospital, there's a contract and it says, this is how much your raises are going to be. This is how much paid time off you're going to be. This is what your holidays are going to look like. This is your patient ratios. And it's all spelled out in your nursing contract. You meet and you negotiate, or your union negotiates for you on your behalf with the hospital system every few years when your contract is up for renewal. When you cannot come to an agreement, or your representatives cannot come to an agreement with the hospital, sometimes you hit a point where they say, okay, fine, then we'll strike, which means we're not going to come into work and you will have to figure it out. It's kind of just like it's your weapon, right? And you don't want to use it because the nurses who are there, they don't get paid for those days. The hospital suffers, obviously, because the patients suffer because they don't have the nurses who usually work there. The hospital suffers because now they're having to pay to bring in a bunch of other people. There's going to be a lot more accidents. It's a mess. It's a last resort type of thing. But this is where they were sitting. They were saying, hey, we're not getting paid near the amount of money that is judging for, we have not been getting rates of pay increase adjusted for inflation. We're getting paid way less than nurses in surrounding hospitals. So they came together. They did vote, yes, we want to strike. And now they kind of came to the bargaining table one more time, now that the union had the power of saying, hey, we did vote to strike, so you need to give us your best offer. And the hospital apparently, we'll see. They didn't give a very good one. And so here we are. Now on September 1st, they gave them their notice to strike. They have to give them 10 days notice. And they did that on September 1st. They said, hey, on the 12th, we are going to have a 3-day strike. And now you don't need to watch that other video because that's the whole summary. I did go into, I think, a little bit more about unions, and some people in the chat gave their opinions, but that is the basic summary there. So 15,000 nurses in the Twin Cities and the Twin Ports and Moose Lake, that's exciting, will be striking tomorrow, Tuesday, and Wednesday. In response to, hospital executives have made desperate attempts to further attack the collective bargaining rights of Minnesota nurses, demanding an additional step that has not been previously requested or required to attempt to prevent nurses striking for better patient care working conditions. So you may see floating around some article that says oh, this is an illegal strike that they aren't allowed to be doing. And that is not true. That is something that is being spread by the National Right to Work Foundation. They are our first villain. So I'll show you really quick. We can hop over here. They have come out with something basically saying, oh, the union, because this looks really bad for the hospital, right? This doesn't look good at all for the hospital, who patients are looking at the internet or they live in the community and they're like, oh, why are these people saying these absolutely terrible things about this hospital? Why don't the nurses want to be inside the building working? It doesn't look good for the hospital, right? It doesn't give you all the good vibes that none of the nurses want to be in there and that they say the staffing is unsafe. So hospitals hate obviously strikes. And so does this company. The National Right to Work Foundation are basically the people who align with the hospitals usually. This is for unions all over the country, doesn't have to be in healthcare. And they fight back against unions. They don't like unions. Their stance is like, oh, we'll help you get out of your union if you want to. And if you want to get out of your union, then here you go. You can look at these people. But they came out and they said, oh, this is actually like illegal. You shouldn't be able to do this. The MNA's union monopoly power, the strike scheduled on MNA will affect 15,000 nurses, impacting the care of countless patients. The foundation's legal notice informs nurses of the rights the union official often conceal, include that nurses also have the right not to abandon the patients, but instead continue providing medical care. So like saying like basically like, oh, you're taking all the patient, you're taking all the nurses. This isn't even legal. And then they say somewhere else, they're to go on to talk about the Mayo Clinic and how like they're having union issues. And then they talk all about how, this is not even fair because now I can't even find it on here. I'm like, why did I even look at this before? Somewhere on here they talked about, you can probably see it and I can't even see it. This is illegal and they shouldn't even be doing this. Well, it turns out that the thing that they're saying, oh, you have to like get it approved, give a longer notice, like 30 days, but that's for public hospitals. That's not for private institutions. And all of these are private. So if you see that floating around, that's the deets on that is it's for private. It doesn't apply to private institutions. And this is a private institution. So maybe one day we'll find the actual link that shows that, but it's fine. We tried. M says, go University of Wisconsin and University of Michigan are not far behind. I know that, Michigan, I don't know if U of M, I may or may not have experience at U of M, not denying or confirming that, but I may have known people who almost went to strike at U of M, didn't end up getting there, but we did authorize a strike. And by we, I mean, obviously they never would say where I worked on the internet. But they did authorize a strike and we never had to strike because then the hospital pooped themselves and they were like, well, fine, here, you can have what you want. And what we wanted was just safer patient ratios and parking because we're petty and it's Michigan and it's cold. Okay. Going back to our other article, since that last one was a fail, just to get the rest of the vibe, after MNA filed its required notices. So basically, when the hospital decides to strike, there's like a chain of command of things you have to do. Hospital executives are now demanding, it was in this article, if I just kept reading, they're hospital executives who were instructed by the Right to Work Foundation, told them they have to file an additional 30-day notice with the State Bureau of Mediation Services, despite the fact that the Bureau of Mediation Services does not have jurisdiction over the private sector employees. And that is why hospital management has never previously asked to do this. And that's why it's unfair. But they're going out and they're spreading. I saw tons and tons of things I was looking for what's the hospital saying? And the hospital is saying this. All the hospitals are posting all these things about like, this is illegal. Like they're not even going through the right channels. We're going to take them to court. And of course, you never see them taking to court because it's not legal. So again, if you see that out there, the hospitals are using it. And it's just kind of crappy. This is the official statement from the Minnesota Nurses Association in terms of their negotiation. It is clear that hospital executives are feeling the power of 15,000 nurses fighting for our patients and our profession. We will not be intimidated by their attempts to silence or scare us, and we intend to proceed with a strike to win fair contracts to put patients before profits. This was kind of in response to all the hospitals being like, we're going to sue you. And they were like, silly people, sit down. Hospital executives have already driven nurses away from the bedside by the refusal to solve staffing and retention crises in our hospitals, and we hope they will not be so brash as to fire nurses for standing up to demand better. So there's always, I think people are always nervous about like you're losing your job in case of a strike. Like what if I don't honestly know the legality around that, if you can get fired regarding a strike, but I mean, to hire 15,000 nurses in this moment just seems very stupid since they're a little hard to come by. If hospitals executives want to avoid a strike on September 12th, they should spend less time and money on lawyers and more time working with nurses to settle fair contracts and improve patient care and working conditions in our hospital. If you just put that energy, I feel like this all the time for all things related to union negotiation. Like if you put half the effort, hospital admin team, into tackling this that you did into everything else, maybe we would not be in this situation. But we're here. Maria Brick said, exactly. They will require more nurses to work per shift to actually safely cover the patient census. That costs the hospital more money. This is wildly expensive for the hospitals. Absolutely wildly expensive for them. And it's unsafe for the patients because you don't have the nurses who are used to the facility. Usually, when you have travel nurses and people coming in, you have enough nurses who have worked there and know the drill. They know the healthcare providers. They know where all the stuff is. They know the patient population. They know how things run, that it's okay. I would hate to be in the hospital on that day when like as a family member of a patient or as a patient or as anyone else working in that facility when this is going on. Interestingly, the medical students and I believe the residents that are associated with a lot of these hospitals did come out and publicly say that they supported the nurses, even though it's going to be like a really horrible few days for all of them. They did come out and say that they were supporting the nurses, which I thought was really great. And probably I don't know this for sure, but I'm sure it made somehow the AMA mad, the American Medical Association, because the American Medical Association and the hospitals are like BFF pals most of the time. Sometimes they hate each other, but I just assume that the American Medical Association hates everything that nurses do. So maybe that's totally off, but they hate nurses. So I hate them. Everything I said might not have been true right there, but it's fine. Maggie Powers. Ooh, this is a yikes detail. Also, your hair. It's an excellent picture, Maggie. I heard that the strike is costing the hospitals about $40 million each or altogether, because that would cover a lot of nursing salaries. So, and which brings up the topic of why are they even striking? Mama Nurse would like to know if any of you are striking. Do let us know if you are striking, if you live in the Minnesota area, if you know of any details. And as always, if you have any fun emails that your hospital has sent out regarding this or about anything juicy entirely, it doesn't have to be about Minnesota. My email is in the chat. And if by chance something happens to like fall into my inbox, trips and falls into there, it will maybe be anonymously shared with the internet. And we can play a game like Gaslighting Bingo, or we can even come up with a new game. But I'm just letting you know that that is always a possibility that if you leave that there, it might end up there. So things that nurses want on this spiel. Okay. They were like, hi, we'd like a little bit more money. That would be great because other places are not, they're paying like $10 to $12 an hour less than other hospitals in the area, which seems kind of crappy. I'm like, well, we could probably do better there. And then sorry, hang on. I have to change something on the back end here really quick. And I can't do more than one thing at a time. And my second opinion is not here. I don't even know if I can change it. Well, if you're all stuck here forever, the thing I'm trying to turn off is the thing that when I turn off the stream from StreamYard, that it'll turn you off. And it might be problematic because it won't let me do it. So you might be stuck in the stream absolutely forever, which, good luck with life. We'll go there. Okay. Whatever. We'll do it later. Yes, email, shameless email plug. You can also sign up for my mailing list. There's going to be a link for that one day. It's not there yet. But you can also do that to get fun emails from me, but that's just my email. If you want to email me, things that might fall into my inbox. Yep. Saw several travel contracts were offering $7,900 to cover the strike this week. Wow. Wow. That's wow. Let me see. Aya had strike positions, but they terminated them. Won't be the first time I've been tuned out. Won't be the first time I've been tuned out. My brain's gone. I can't understand what that means. I've seen 10K. Oh, 10K for covering these contracts. So what we're talking about now is how much are hospitals paying people who want to come in and cover for the nurses that are going to be there. Usually it's quite spicy. There's a lot of mixed feelings. I think that it gets the point across and it takes care of the patients. So I mean, really, like, it's fine. Um, get your, get all your money. Someone needs to take care of the people. A lot of people don't like people coming in and covering. They're like, oh, this just makes it worse. But I mean, they have to kind of get taken care of. And that's a lot of money. Sewing for Joy, Liz, what state do you live in? Pennsylvania. I have lived in Michigan and North Carolina and Delaware and California as well. Yes, I think that's all. Out of Depression's Dear Feet. Cool name. 7,900 to 10K. Unbelievable. It is unbelievable. So some people will call them scabs. So we can address this. Scabs are cowards. I don't know, but what else are you going to do? Like, let us know in the chat. What else are they going to do if they don't have nurses to come in and cover? So the term is scab that a lot of people will use. A lot of people don't like that term, kind of like put a, stop the bleeding. Like I said, I don't really care. If you want to get all your money, you're basically getting a ton of money from these hospitals. The hospitals are going to suffer. The patient care is going to suck. No offense to the people who are going in, but if you don't work in that institution, it's not going to be safe. So in my case, I'm like, well, you're just going to pay me a bunch of money to work in this hospital. Someone has to do it. Like, realistically, hey, if you want to go and make that much money, by all means, by all means. Matthew Ives says, I'm all for having travel nurses covering the strike. Yeah, for sure. Me too. If you're going to bleed that hospital out of money, you do you. You're getting the point across. There's going to be a ton of lawsuits associated with this. When patients and their family members sue, it's just going to be a thing. Yeah. The biggest thing is, it's huge, like a terrible problem for the hospital, and a huge, huge, huge PR problem. So really, it's fine. That's what I say. I mean, I know some people don't agree. But I'm like, whatever, you get your money. That sounds exciting. That's probably, I could never be a travel nurse, but I mean, that's a lot of money. That would not be bad. Let us see. So things that they wanted to have, and let me know if you, like I said, work there, if you, if you have any other insights. But the main things that the nurses at these hospitals wanted, and it's across several hospitals. Okay. It's not just at like one, it's across several, it's across, I think, 7 health systems, 15 hospitals. I'll find the number somewhere. But they would like to be paid a little bit more because they're not getting paid as much as nurses in similar, like in the same city. Basically, they would like to have safer patient ratios that are a little bit more mandated. So someone saying like, hey, you work on this type of unit, you can only have 4 patients. You work on this type of unit, you can only have 2. More like protected paid time off, because just because you have paid time off doesn't mean you can take it. Like if you constantly submit and you're like, hey, I want to take this time off, and they're like, oh, we don't have anyone to cover you, there's no point in having the PTO. They would like that. It is for, Mama Nurse just said it's only for bedside nurses. That's a really good question. I think it's for I don't know. If you know if it's for bedside or not, I assumed it was probably for just bedside nurses, but I'm not sure. Are nurse managers walking out as well? Mandy asked, just curious. I'm a unit supervisor and I would support my team. Most of the time, at least when I worked at Michigan, the managers were not part of the union. So admin staff they could not be in the union because it was seen that they would not be able to be like objective. Like you can't play for both sides. You know what I mean? You're either on the management team rolling these things out. Usually there's like some kind of like you can't be the person who's controlling the labor conditions while also being on that fighting side. So a lot of managers and stuff did support the nurses through various ways where they would really go and advocate for them. But no, at least in my experience, and that might not be a situation everywhere, but where I was, management could not be on. They had to show up, like they were not part of the union. So other things that they're wanting are, let me see if I have it. Oh, here's what I have, a whole link for it. Past Liz knew that future Liz would be a little bit scattered when she was trying to run a live stream all by herself, like a big girl. Told my sister it's fine. So my sister Rachel, keeps my life afloat on YouTube. And I was like, it's totally fine. I'm sure I can figure out how to do a live stream by myself. I don't know if we're succeeding. I was like, don't check in on it. Everything's gonna be fine. Okay. Negotiations will continue. Well, they tried, but didn't work out. There is a current, they were announcing strike would include 50,000 nurses. There's been no major progress. Said Angela Becchetti on Friday evening. She's a nurse at the Abbott, Northwestern, and part of the Minnesota Nurses Association negotiation team. So those are the people who go and fight with the hospital. They have actually come and address our proposals, and they're just not doing that. So they're like not meeting with them, which happens a lot. A lot of the times you would run into situations where the union people would go and want to meet with the hospitals, and they just like literally would not send people. And you're like, well, that's interesting. According to Becchetti, the nurses union's top priority are staffing, retention, and addressing workplace violence. So those were the other two. Retention being how do we get people to stay, which is through things like safer patient ratios, which is they've talked about being able to take PTO, just making it somewhere that you would want to stay and work, paying people competitively, giving them raises, and addressing workplace violence. I mean, that seems not shocking. We recently did that live stream about Eugene, who was attacked at work. So that's like kind of in the back of everyone's mind of like, oh, wow, like, why do so many healthcare workers get attacked? This is not okay. I will leave that one linked down below. Ridiculous. Like, what about that? Nothing. Um, Safety at the bedside, metal detect, and they want safety at the bedside, metal detectors. Okay. At the entrances, and also notification on the streets that if we need to stay clear of an issue, better protection if we're injured, to have covered and right access to resources for care for ourselves, etc. So also very, very reasonable things. I would like metal detectors in the ERs so you can't just like waltz in with a gun. I would like there to be like, just anything, anything to protect people, but not important. So it's fine. 16 hospitals that could be affected by the strike. So not 17 across 7 healthcare systems. These are the hospitals right here: Riverside, Southdale, St. Joseph's, St. John's, St. Mary Duluth, St. Mary Superior, Essentia, Moose Lake. I just like Moose Lake. That sounds fun. I'm imagining a bunch of moose like sunbathing. Is that what happens? Or are they just around the lake? Can moose swim? Let me know. Abbott Northwestern, Mercy United, Unity, Children's Minneapolis, Children's St. Paul, North Memorial, and St. Luke's. I would love to avoid it. I think everyone would love to avoid a strike. No one really, it just sucks. I would love to go to my nurse and say we came to a tentative agreement. And that way, they said, I just don't think it's going to happen that way. They talked a little bit about kind of where the negotiations were. Our negotiating team is meeting with the union again today. So this is like from the hospital's perspective, and we continue to hope for continued progress since the open contracts will only be settled at the bargaining table. We are disappointed that the union continues to demand an unsustainable wage increase of more than 30% over 3 years, in addition to many other economic benefits. So they're saying like, oh, they want a 30% increase. But if you look at the numbers, the 30% increase would make it market value for that area. So the nurses literally just want to be like brought up. Like I said, they were like 10 to 12 or $15 an hour lower than the hospitals in the same area. So they're like, hey friend, like we just would like to be paid what everyone else is being paid, and other economic benefits. Yeah, let me take my PTO. Give me something towards retirement. Help me with my benefits so that when I get hurt at work because you won't protect me, I can go and get health care. please. But that's asking a lot. MNA initially, so the Minnesota Nursing Association initially requested a 15-year increase in the first year of the contract. So like in salary, 15%, 12% in the second year, and 12% in the third year. And then they have now dropped to 13, 9, and 8 in the third year. So they've budged. They always make it sound like the union will never budge, but here they came down and they said, hey, we'll come down to this. And that's very normal in a union where it's scheduled out. When I worked in one, I knew as a nurse what my salary was going to be through the next, we did 6-year contracts, I think, because I knew what my salary was going to be with uh, my like pay increases every year for the next 6 years, and then what my bonuses would be, how much paid time off I would have, because all of it was based on seniority, which is part of being in a union. And when the hospitals came and tried to meet with them, so nurses were asking for 15, 12, or 13, 9, and not 8% increases in their salary, and the hospital offered 5, 4, and 3. So we're willing to make movement on any of our proposals as long as they address some of our big issues, is also what the union said. So, hey, if you don't want to budge on the money, if you just budge on the patient ratios and the paid time off and making sure that we're safe and making sure our patients are safe with these staffing ratios and trying to do something to make us stay, maybe giving us like healthcare. And they said no. So it's a little bit ridiculous, and many of them in other articles I've read have said like, it's really not as much about the money. And some of the hospitals have even said like, hey, let's come and talk about the money, and we can take less, just, like they're saying, just give us these other things. And the hospitals were like, no, do you want more money? And they were like, well, no. Exactly. So it's just and Mr. Midwife said patient ratios, that would be money. And yes, if you had the same fewer nurses per patient, so like on med surg, maybe they mandate 4 to 5. It costs more money, but all of this in general is just so incredibly short-sighted, because in the end, having better nurse ratios would be it would save the hospital money. Less mistakes would be made. People would be able to think through things a little bit more. You would catch more things. Safe staffing and like making people who work at your company happy in the long run would save you a ton of money. Like I said, less mistakes would be made, so that when less things would happen, that then insurance companies would come back and tell the hospital, we're not paying for anything because your nurses didn't have time to turn the patient. Then they got a pressure ulcer. Now we're not paying for the whole visit. It would save a lot of money. But what do I know? What do I know? Yes, Trisha Jackson says 5, 4, and 3. That's a spit in the face. It really was. Rogan P said, I wonder if negotiations for hazard pay are going to start becoming a thing after COVID and the extreme circumstances that nurses and medical staff went through. I think everybody got hazard pay or some people got hazard pay for a little while, and then it went away. Marie Brick said, but they can afford to give the CEO a 90% pay increase. Yes. So this is the interesting part. And we can look at that because, as Matthew said, every time I say they can't afford it, I look at what people at the top of the hospital are making. And let's do that for a moment. Shall we look at what the people at the top are making? Because it's not a small amount of money. As my mother would say. I like when she talks, she always says things in like, well, it's not bad, or it was not cheap. Instead of just being like, yeah, that was expensive. Here they are. So Blue Cross Blue Shield of Minnesota. These are all the people who are striking. These are a lot of them. So we've got 3.5 million. Hennepin Healthcare, Jennifer has the most reasonable salary of $586,000 a year. But we're going to be hearing from like Essentia Health. That is one of the people. So that's 2.8 million. So North Memorial, I think that was on there, 1.5. Children's Minnesota, 1.4. UCare, 1.3. Fairview is one we have. We have some emails from you, Fairview and Essentia, 2.6 million. So these people think that they should get paid money. That's totally fine. Millions and millions of dollars. However, they're not very much willing to give any of it any of it back. So yeah, Rogan P said, "Oh my gosh, that's so much money. It is so much money." Like, and their salaries themselves wouldn't fix, even if they gave all of that back, it wouldn't fix it. But clearly there's like, it would still save them money in the long run. One, because they're not paying for this strike that's going to cost like $40 million, like someone said. And patients, it would just be safer, and safety equals money, which is why hospitals care about safety. Because when things aren't safe, they don't care if the patients are not safe. They don't care. They like to act like they care, but they want patients to be safe. They want people to be safe because if they're not safe, then they lose money. Then the insurance companies say, well, we're not paying for that. Pamela R says, does anyone else feel like the current healthcare system is going to crash and be reborn into a different type of system? I feel like it's an abdominal incision about to dehiss. Yes. It's an excellent, excellent imagery. So dehiss is when it busts open. Fun story about dehiscence, just because. Why? If you don't like hearing about nasty things in healthcare, just skip like the next 1 minute. So I have had a patient, I worked on a med-surg GI unit, and she like, I was standing on a corner, like helping a different patient. So I'm walking them down the hallway, and I hear this other patient who had an abdominal incision. So an incision going up and down their stomach. They had a wound vac on it, and because it was not doing great. And I was with this other person, like helping them. I think I was like helping them tie their gown. Like they were wandering around without any clothes on. And I was like, please let me help you. I think, and while they were also like going to the bathroom in the hallway. So I'm like a little occupied over here. And I hear this other person very coherently who has the abdominal incision. I was like, what are you doing? Like, what are you doing in the house, in the whatever, like in the walkway? Because I didn't know this person could be like ambulatory, which like walkable. I didn't know they could be walking. And she said she was having a snack, walking around. She was like, I got really hungry. Unfortunately, my guts fell out. I was like, oh, haha. Like I thought she meant like, oh, like, talking about her surgery. Only to find out as I walked my other patient who was actively going to the bathroom on the floor, now that I had at least a gown on, that when I walked by, her wound had dehisced, it had opened up, and her guts had in fact fallen out. And she was just sitting there eating saltines, holding with one hand, her guts falling out, and eating saltines with the other hand. And I was like, oh my gosh. And then I immediately called, obviously, tried to deal with the situation, called in the middle of the hallway, the team. And I was like, the patient's wound dehisced. I need you to come here immediately. We are in the middle of the hallway. Cause I was like, don't move. And they told me that I didn't know what dehisced meant. I said, the wound has dehisced. She is holding her small intestines. I need you to come faster than anything that you could imagine. And they were like, I don't think you understand what the word dehisced means. That's a big deal. I was like, I don't think you understand what my patient is holding her guts means. It is a big deal. I need someone to go. So I'm like, oh, it was just such a it was such a mess. Rogan P says damp cloth to keep things moist. Yes, I chose the method of standing there and yelling down the hallway, please someone help me, because I still had this person over here who really couldn't walk by themselves and needed a lot of help and was very confused. And then she was just very happy for the moment, sitting there and munching on her saltines. So if you would like to have a life adventure, go work in med-surg. I tell you, it was an adventure. One of the thousands of reasons I don't work on the floors anymore. Yes. So, yeah, not good. Anyway, that's my random, the fact that, and also momenters, the fact that they were questioning you makes me say, yeah. It didn't go well when they showed up and they were like, oh, it really is dehiscing. I'm like, we had a very nice chat with their, attending later. I was like, they were lucky that I was very new. I had probably been there like maybe 3 months when that happened. And if I had been older Liz, who was a lot more sassy and had a lot more feelings, it would not have gone quite as well for them. So this is, let's see, I don't think they had any, they kind of went on to talk about, we can look at Moving on from our dehiscence story. If you have any good dehiscence stories, do let us know in the chat. It's disgusting. And I mean, not disgusting if it's not the person's fault. It's just, well, it's disgusting. The poor people who have that happen to them. Let me see. I've also had people walk into primary care with dehissing things that I'm like, why wouldn't you go to the ER for this? Like, what would you like me to do about this here in the office? How do you think I'm going to put that back together? They had a lot of faith in me. A lot of people had a lot of faith. They're like, I just thought you could fix it up. You're so, I like you. I don't like them. I'm like, I don't like this situation that you have going on where your C-section scar is like all the way open and I can see your internal organs. I just thought you could sew it up real quick. No, friend. No, please don't come here. Anyway, anyone else? Anyone else have these experiences, or is it just me? So this is kind of what the hospitals are saying. Hard pivot over to here. Let's talk about what the hospitals are saying. So a lot of them are now coming back and saying, obviously the public is kind of panicking. They're like, this does not look good. I don't want to go to your hospital. I'm going to be avoiding it at all costs, especially during these days. Children's Minnesota must be terrifying if you have a child, because there's not a lot of other options. If you have a child, right, you'd want to send them to the one hospital. Adults, there's a lot more options. Has a contingency plan in place for several months in anticipation of a possible strike. Most of these plans include nationally recruited registered nurses who are experienced and trained in pediatric care, which is wonderful, but they're not trained in your hospital. Travel nurses have begun arriving September 7th. They will also complete training and orientation at Minnesota Children's in half a day. They will ensure the time spent on a potential strike will continue to provide the care that they need. Families can rest assured that should they need us, Children's Minnesota will continue to provide quality care for our patients. So that's encouraging. And just lots of, we're essentially, we're canceling unnecessary things. We've prepared for the full work stoppage. This is St. Luke's. Our replacement agency has done a phenomenal job filling our RN needs. It's amazing how many nurses will come and work for you if you offer them $10,000 a week. Every position we requested has been filled. There you go. Wouldn't you know? But again, that doesn't make it safe because they're not familiar with the environment. Nothing against the nurses who are coming in. It's just nurses who are coming into a new system are never going to be as safe as nurses who have worked there for a long time. We have rescheduled some non-urgent surgeries. Everything's fine. Affected patients have been notified. We appreciate that they're understanding. I'm so sorry. We're the word. How do those phone calls go? Hi. So our employees, our nurses would like to be paid a living wage, be able to take time off. They want to stop being assaulted. And they want a manageable number of patients, and we're not really willing to budge on that. So we have to cancel your colonoscopy. Have a great day. Please rate us 5 out of 5 on Google. Essentia Health said in a statement, while Essentia Health continues to negotiate a new contract, so we're trying. You forgot the part where you're not budging, Essentia. That's the part that you forgot in that statement. It's important to note that our hospitals will remain open and accessible for patient care, even if a strike occurs. So please come here. I'm sure someone will take care of you. Like any responsible health system, we have prepared a wide range of contingencies to ensure that we can maintain our high standards of patient care, including uninterrupted, urgent, and emergency care. Great. These plans include bringing temporary and licensed nurses in. Wonderful, wonderful. So the same plan. The patients will be contacted. Health systems are accustomed to navigating difficult situations. Oh, this is interesting. Health systems are accustomed to navigating difficult situations, especially since the onset of the COVID-19 pandemic. Except during that, you had your nurses. Crickets. You had your own staff. There will be steps we can take and resources to use, as support is our top priority, which is the safety and well-being of our patients and communities we're privileged to serve. Because if we don't serve you, we don't make money. And if we don't keep you somewhat safe, we also lose money. It's the unwritten. That's the part they just didn't say out loud. So that's kind of what everyone is going around and saying. The Minnesota Department of Health, let's see what they said, shared a statement saying the Minnesota Department of Health is prepared to respond to complaints and monitor impacts of patient safety during the strike. I would hate to be those people. Sounds like a terrible job that they're going to be very busy. MDH's Health Regulation Division is prepared to fulfill its role to protect patient safety by responding to complaints and monitoring impacts to health and patient safety. It's going to be interesting to look at those reports. I hope they make them public. Once a strike occurs, MDH's Health Regulatory Division meets internally to monitor any potential impact and receives ongoing updates from affected hospitals. That will be interesting. Does anyone know if they make those public? In regards to staffing shortages or other problems the hospital faces, hospital strikes must address how they will handle these types of situations by hiring staff travel nurses. Hospital plans can be individual. They may determine the need to curtail services to meet patient needs. So that's saying like, hey, we're going to close our ER. We're going to divert, which would mean no one else can come to the hospital. Maybe, I don't know if they would ship people out, but usually it just means you're not taking new people. You're not going to do surgeries. You're just going to kind of like pump the brakes. A strike plan should include the process put in place to ensure they can continue to provide safe and appropriate care. Hospitals have protocols in place, blah, 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 blah. Okay, so everyone's kind of saying the same thing. And I really hope we can get a hold of that other document that says how the safety is impacted, because that is fascinating. What will they monitor? I would assume they would probably monitor, just things like falls, how many people died, how many people got, infections that they didn't think they would get, what were the outcomes, what were the ER wait times like, what were the discharge home and then return admission rates, what were like those types of things, and then who complained. I would love to see those complaints. Rogan P said, didn't they originally say this wouldn't affect them in that nasty letter that was sent out? Yes. In their nasty letter that we sent out last time that we did in, if you have not seen Gaslighting Bingo, our first episode, that we talk about that there. Basically, the hospital was like, this is totally fine. And this will not affect us at all. This is the nurses having a temper tantrum. We're thrilled. We're actually happy that this is happening. So that was the vibe they were giving off. They've changed their tune a little bit, just a little bit. Em says, I just watched the interview with my mom. Just such a calm voice. She does. When she's in her nurse voice, it's very calming. Most of the time when she's talking to me, it's very calming. This might shock you, but sometimes I can be really annoying and defiant, especially in my youth. It hasn't gone away, but now it's Joe's problem, not hers most of the time. And sometimes it's not so calming, but she's the best. Love you, Mom. They may monitor, but we'll probably blame the nurses. Yeah. Example of what will they monitor? Was the wrong leg amputated? It's an excellent thing to look at. Matthew, I've said, I think bingo will need tick marks rather than X's. Yes, I haven't figured out a way to get the tick marks live on the screen. So we're going to use our imagination. If you have an idea for that, do let me know. But I do have a bingo card. And this week, I'm hoping that I can get a second opinion to make it something that you could download. We just have to figure out how to do that. I am not the person who implements ideas. I'm simply the one that has them. And I spit them out. I'm like, can you make this happen? And then sometimes they do. And it's pretty great. Pretty great. I'm assuming also Maria says that someone is still there and able to collect data for what went wrong. Oh, true. Nurse Adrian is in the chat. Hello. I hope you had some rest this weekend. It's going to be an epic strike. Adrian knows everything about strikes. Go follow her. I'll leave her TikTok linked in the description, and her YouTube videos and her Instagram. She is our strike person on our team. And Mama Nurse is the person who knows everything and is very calm. And Mr. Midwife, dear Chad, and I get riled up together. And we're going to take over the world. So that's the rundown. Google Doc and then paint on top of it. But I don't know how I would change it depending on where we go. So I'm working on it. Kim says this blows my mind. They literally are throwing a toddler temper tantrum by blatantly refusing to simply treat nurses better. It is shocking, isn't it? It is a little bit shocking. Okay, so here is today they did have like a rally that they went and they did. They're getting ready for tomorrow. Here is what to expect. Oh, this is just the hospital saying everything's going to be totally, totally fine. Don't even worry about it. Everything's going to be fine. Things are just great. And we have that. Okay, so we've kind of gone over the whole thing. Anyone have any questions about where's Scott? Scott Scott, where are you? Where are you? This is mandatory attendance that I did not tell you about. How dare you not be here? He's probably studying. He sounds like a very good student. He's so if you don't follow our panel discussions, Scott is also a very big voice of reason. Um, and he he keeps like texting me and he's like, can you show me like how did you do this? I'm like, Scott, I didn't do that. He's like, what do you mean? I was like, I didn't read, Scott. I didn't do the readings. He's like on time. I'm like, no, Scott, like period. We're different students, you and I. We are different students entirely. I just didn't read. Nurse Adrian said, hi, Liz. I was just reading an article that the US corporations spend minimally $300 million in labor aversion consultants. I'm guessing it's likely double that. Lovely. The labor aversion consultants would be that lovely, lovely National Right to Work Foundation, things like that, where they go in and they have a bunch of propaganda against like labor unions are the worst ever. And if you join them, not only will you die, but every firstborn child in your family will die and all your horses will too. So that's them when they come out and they like threaten everything. They're like, this is going to light everything on fire. That's them. Strike breakers are a tool of union busting. The hospital can settle anytime, and the decision to strike is the last resort. Yes. So like we said, it's their last little weapon, last weapon that they have in their pocket of like, hey, that's what the benefit of a good union is you have this in your corner to fight for you. Chad didn't read either. So that's why Chad and I get along. Like, burn it to the ground. I didn't do any of it anyway. I'm fine. Rogue NP says, I want to see the CEO on the floor helping with a code brown or fetching warm blankets for sure. Code brown is when there's a lot of poop. I don't even know if they could find the blanket warmer. They're probably like, we have warm blankets. What? A few miles says, I work for a locum staffing agency. Locum is where like travel nursing. Essentially, I wish I could show y'all how much these hospitals pay to get these nurses and doctors to their facilities. Oh, I bet. I bet it is astounding. I bet it is absolutely astounding. Kim says, that's me. My sister's in one cohort behind me, 2 months behind. She always asks me how I learned this or that. I'm like, oh, I don't. That's me. I'm like, there's YouTube. I just YouTube things. We'll just YouTube it and see if we can find it. And that is why, and then when people I went to nursing school with, they're like, you have a YouTube channel about nursing? I don't know if that's safe. I'm like, it's probably not. I've always been very upfront with it. Don't be me. Okay. Just don't be me when we're doing all of this. Let me see. This one says, okay, pretty much more of the same. I have different salary things. Basically, everyone makes a ton of money. And they don't want to share it with the nurses. They're being mean. They're the villains. Okay. Hospitals, villains, nurses would just like to be paid fairly. We're going to support them in whatever way you would like. I will leave a link below to the ways that if you like live in the area and you would like to like do the picket thing with them. I don't really know how it works, but you can like sign up. Or you can give them like a monetary donation or, those things. To be totally honest, don't know what that exactly goes to. I'm assuming to help people like coordinate it and maybe help pay for food or something. Totally not sure, but I will leave the links down below if you want to support in that way. Another free way you can support the Minnesota nurses is just by talking about it, sharing it on social media, explaining to people who are going to be saying nasty things about it, combating information that you see out there of, hey, these nurses are super selfish. And, the poor hospitals, just combating that with very factual, like, hey, did you actually know that they're asking, the nurses have actually moved their needle. They've said like, hey, we'll take less if you just give us more, we'll take less. And the hospital is not budging. And, it's really not unreasonable to ask for, metal detectors being paid equitably to your peers in the area, kind of just having those conversations and sharing on social media and all of that. Nurse Adrian said, yes, all strikes appreciate food drop-offs, donations, picketers joining, get your community involved and churches involved. And yeah, just being in your community and being like, hey, and this isn't just for this union thing. This is for like any of them. If it does go to Wisconsin or if it goes to Michigan, helping your community be aware of what's going on. Because most of the time I found that people in the community like have no idea, at least from when I've talked to people, they have no idea that like staffing issues are happening. They have no idea that nurses aren't being able to like take days off because they literally aren't having them approved. That when you go into work, like how many like we call them code silvers, which is an active like shooter or someone with a weapon in the building. How many of those like wasn't even shocking. You're like, oh, okay, another one. Like how much of that we deal with, people don't know because we don't talk about it because the hospital, if you do talk about it, shuts you up immediately or fires you. You know what I mean? I am able to talk about it because I don't work for a hospital. They can't come after me. But a lot of people aren't in that position. So just having those conversations in your own community, not necessarily even on social media or in a way that protects obviously your employment. Having those conversations is so helpful. A Montana gal, we needed a national strike. It would really help if we had kind of like a national way of doing things, but that's not the way we work. Most of healthcare is at the state level, but it would certainly make it easier if we just had like a national nursing like requirements and rules, like, but one can dream. Nurse Adrienne. So Nurse Adrienne, like I said, is our all knower of all the things. The money for strike breakers is partially funneled via Medicare and Medicaid money. We have to be cognizant of where the money comes to pay for strike breakers. So that's interesting that the money is actually coming from, so to pay for the nurses who are going to come in, some of that money is actually coming from Medicare and Medicaid. Oh, that's interesting. So it's interesting that they would pay for that, but interesting. Hospitals will spend more money on a strike than the entire cost of settling a contract over 3 to 5 years. It's all about power and maintaining the oligarchy of absolute power with workers having none. That sums it up pretty well. You're the best. Thanks, Adrienne. Yeah. Basically, they will die on that hill of like, hey, you aren't going to get what you want. We aren't either. We're willing to bleed all the money just so that you don't get what you want and you don't think you're in control. But here's the thing, friends. If we all get together and keep fighting things like this, which is why we're talking about it today, why I think you should talk about it with other people, eventually we win. There's more of us. You know what I mean? And they assume that everyone will get tired and stop. If we all don't stop, if we all like just keep talking about it and keep fighting about it, someone is going to need, like, something's got to give eventually. You know what I mean? There's way more of us than there are of them. Also, no other unions will cross the picket line. UPS will force hospitals to take deliveries on the street, for example. That is very interesting. So other unions won't cross the picket line. If trash collectors are union, they will not cross the picket line to pick up trash. I did not know this. Teamsters will not cross the pickup line to make deliveries. FEMA or SEIU, I don't know what that is doing the solidarity pickets, but I did see something about that. Interesting. FEMA paid during COVID to bring in. So FEMA is like a little something, emergency response, something. They helped pay for people who came in as travel nurses, apparently, which is very interesting. Yikes. Labor Meme Core says labor organization is our biggest tool in challenging homogenic power. Yes, that word. I can say big words. SEIU is the union most of the hospital custodial staff and aides, etc. are. That's very interesting. Yeah, that's cool. I love that. Because so this is just for the nurses too. Like I've seen a lot of things are like, oh, is this like the CNAs? This is like, this is the nurses. I'm not sure if it's LPNs and registered nurses or if it's all nurses, but it's not going to be other staff. It's not professional to treat nurses and healthcare workers as indentured service. Amen. Amen. It's not professional. It's very rude. It's all the worst things. Sophia, thanks. Subscribe, like, join the channel membership. Thanks. I appreciate you, friend. If you do compressions on it, on the like button an odd number of times, it helps save the life of the channel, and it tells the YouTube gods that you like this and you would like it to survive and go out to other people. So if you could do that, that would be bomb. And yeah, if you want to do those other things to support me, join the channel or as a friend of the channel or subscribe or do those things or tell your friends about it, I won't say no. I appreciate you. Rogue NP said, so wait, if Medicare and Medicaid money is being funneled to pay for the workers to cover the strike, does that mean the money is being taken away from caring for patients? That's an excellent question. I was wondering, like, so you'll pay for that, but you won't change your laws or like the way you require safety. So Medicare and Medicaid, we've kind of talked about this, makes a lot of the rules because they are the government health insurance. They won't say, hey, you need to make ratios, which then harms patients because if nurses have too many patients, they're overwhelmed. So they won't do that, but which then leads the nurses to strike to try to stand up for themselves. They won't pay for the hospital for the patients that get injured because they refuse to put limits on a system and say, hey, you have to mandate ratios, but they will pay to cover the hospital's butt when it comes down to it. So that's interesting. That's interesting. Adrienne says your analysis was correct. Vanessa, she said yes. Yes, that is how it's. Matthew says mostly recovered. Clinical start Tuesday should be interesting. I think I can keep up. I hope so. Maria, I'm very political, so I think this is a hot mess. If you don't like that, you may want to go. Fair warning. We need so much healthcare reform, and I think we have to be political about it, and not like pushing our own like picking this agenda, but like I'm not even trying to be political about it. I just think it's so important. Like we need a better healthcare system. I think we need national healthcare where everyone just gets it because they're a human and they deserve it. That's my take on it. But I don't understand like when everyone's like, oh, I get this law, like, oh, you're like being too political and you're being like all crazy liberal. Like, I just think people deserve healthcare. Like if that puts me in one camp, like that's fine. I mean, I am very liberal, but not because I'm trying to be, but just because I think everyone should have healthcare. Like, you know what I mean? About the staffing ratios. Oh no, I am too. I'm just saying that's why they don't want to put in the staffing ratios. Oh yeah, for sure. Because then no one will support them. Sorry, you got the brunt of my frustration in my comments. Everyone's always like, oh my gosh, stop talking about all this. This is too political. I'm like, we need to talk about it because it's a problem. And no one wants to talk about it because it's political. So you got the brunt of my frustration. I'm sorry. Everything about nursing and anyone with a license is political. Exactly. We're paid through a government process via insurance, Medicare, Medicaid. Yes. If Liz was in charge of the world, all the healthcare systems issues would be gone. I don't know about that, but we'd have a lot of other issues. It would be very different. It would be very, very different. I don't know what our issues would be. Our issues would be it's not organized. The world would not be organized. It would be an interesting place. Interesting place. Absolute monsters view healthcare as a privilege. Yeah, exactly. Okay. So are you ready for a new segment? Okay. I made an intro because of course I did. Are we ready to play? Where'd it go? Hold on. Please hold. Oh. Things I do at 1 a.m. when I should be sleeping. I'm like, look at this. Look at this. Yes, here we are. We're going to be playing Gaslighting Bingo. If you're not familiar with Gaslighting Bingo, emails fall into my lap unknowingly, on accident, from people who are in jobs that they're like, hey, I got this email. You might find it interesting. You might want to read this. And then we play with our bingo card and we see, can we get bingo with gaslighting principles, which are on this card. So as a brief review, lying, spreading rumors and gossip, distraction, minimizing thoughts and feelings, rewriting history despite proof that it's not existent, everyone else is lying to you, eliminate self-confidence, isolation, projection, using kind and loving words as weapons, the long game, which is basically wearing you down over time, and then you give up your soul. So then you go along with something that's not very nice to you. Look at what you made me do. Oh, look what you made me do. Denying wrongdoing, shifting blame, use what you love as a weapon. So like, oh, don't you love your patients? You're not taking care of them. This is your problem. Or incite chaos. So these are the things that someone who is gaslighting someone, hold on, I need to scooch this way, will do. So what we do during gaslighting bingo is we go through and we read different emails or comments or websites, whatever suits our fancy, and we see if we can get bingo. I'm just now making sure. I'm like, okay, can you get bingo? Yes. There are the correct number of spots. If you see something while we're reading and you are like, hey, I would like to call using kind and loving words as weapons, just write it in the chat. Okay. And we will get there. This is very much, I'll take I smell like crap for 200, Alex. Exactly. This is what we're going to be doing. So let us read our first. Let us get our first. And like I said, I will be having this available for download at some point once Rachel figures it out. Full disclosure, we're just going to blame her. We're going to be like, I have not told her about it yet, but she has not done it, even though I've not told her yet. And hopefully she has it figured out ASAP. So you can all download it. We just need to figure out how. Okay. So with the goal being then you could look at it and you don't have to remember it because I wasn't very smart and I didn't put this on the other side. I can't fix it now. We'll fix it next time. So you can see both what we're reading and what's happening here. One day I'll figure my life out. Okay. So this is from an email that stumbled into my inbox from Fairview, one of the hospitals that is striking. This is from their chief nursing officer. Okay. We're going to have 2 emails from Fairview. This is the first one. Fairview M&A represented our end. So nurse that works here who was in the union. We are disappointed to receive the Minnesota Nurses Association notice of intent to begin a 3-day strike. We ask you to thoughtfully consider coming to work to take care of patients during this time. We have attached a document that outlines the key pay and benefits impacts to consider when making your decision. So let's just take a brief look here. Shall we? Shall we flip back? So they're saying that they want you to come to work still. They're disappointed. Disappointed in you. And they've attached something that will say, this is how it's going to affect us. Okay. If you do this, yikes. So that's what we have so far. So on this, we'll do a gaslighting bingo so far. We have, what do we have? We have some eliminate self-confidence by telling you, I'm really disappointed in you, because when you sit there and you're like, oh, this sucks. People are going to, think displacement. Exactly. I'll take shaming for 500. Exactly. Perfect. We have demonization. Yes. Displacement, guilt trip. Perfect. Perfect. Shifting blame. This is not my fault. This is actually your fault. Good. Good. What is this? Like the Star Wars thing where he's like, excellent. You're getting just as angry as me. It was a terrible Star Wars impression. I think that's the Emperor or something. We just finished watching Obi-Wan Kenobi. So I'm in a very Star Wars type mood. Nurses who intend to work during the strike may communicate their intention to their leader. You may report your intentions to my leader, and should do so as soon as they make their decision. So as soon as you decide you want to come into work, even though everyone else is striking, you can tell us anytime. Communication of their intent to work is not required. Lovely. A hotline number has been established for nurses who intend to work. Nurses who should call the hotline. So basically, when you're in a union, you're told that you can't really cross the picket line. You can't come to work. And they're saying like, hey, if you want to go back and do this anyway, you totally can. And here's how you're going to do it. Good nurses come to work. Bad nurses, no donut, no donut, no pizza party, none of that. A hotline number should occur. So you're going to go and you're going to call this hotline number if you would like to cross the picket line and go into work as a nurse that works there. This is not for the people who are travel nurses. This is for the actual nurses. We understand that even though we've given you the option of coming into work, and even though we've given you this nice support resource where you can call and be like, I'm scared, Nancy, everyone is hating me for doing this. They'll walk you through it. Even though they've given you those support services, they understand that some of you may choose to participate in a work stoppage. Here are some things to consider as you make that decision, because I'm sure you haven't thought of these already. Bargaining nurses do have the right to work during a strike. You can do this. You can actually work, which sounds like the National Right to Work Foundation response whispering in your ear, being like, you can still come to work. You can still do it, Betty. However, this does not mean that a nurse will not face any consequences for choosing to cross the picket line. So they're saying, like, you may get in trouble. Like, people might not like it if you cross the picket line. Bargaining unit nurses remain bound by the M&A bylaws as long as they remain members of the union. So since you're part of this evil union, some things might happen to you. And the union kind of says what will happen if you cross a picket line, if you don't go with a strike. Important points regarding a private sector employee's membership in their union. The M&A bylaws, so basically, here's what you should know about the union that you're already in. The M&A bylaws provide that a member may be fined or disciplined by the union for crossing a picket line. So they're basically trying to demonize the union in this email by saying, look at what the union will do to you if you might want to come to work, Betty. What if you, Betty, want to come to work? We would love you to come to work. We want you to come to work, but just don't forget that your union is evil and they will punish you if you do. So now they're trying to play like devil's advocate, kind of like get you on their side and show you like, isn't your union mean? And everyone's like, no, this is how we get people to stick together. So you can get fined for crossing a picket line by your union. M&A can only fine or otherwise discipline members of the union. What if you just weren't, what if you weren't a union member? You could get out of all of this by not being a union member. Nurses do not need to be members of the union in order to keep their job. In fact, the majority of M&A collective bargaining agreements provide that no nurse shall be required to become or remain a member of the M&A as a condition of employment. So, hey, they're mean. Did you know this wouldn't apply to you? You would not be fined if you weren't a union member. And did you know you don't have to be a union member to work here? So now they're just trying to get everyone to drop out of the union, which is interesting, an interesting tactic. A union cannot restrict the right of a member to resign their union membership during an ongoing strike. So in case you missed that message, Betty, you can actually stop being a union member. Then you won't be fined in case you really want to come to work on these 3 days. And you can even drop during the union. You can be striking and be like, actually, I'm going to go to work. I'm going to go over here. I'm going to go to work instead. Betty, you can do that. You can just call and you can cancel your membership right now. Here's some details on how to resign from your membership. See the attachment. We're providing you with this information so that you can resign from your union. So they're going very much with the attack of, and this is from Sue Fangle, Maria Rains, Karen Strauman, chief nursing officers. If you have any other questions, we care about you so much. They didn't say that part, but I did. Not covered in the enclosed information. Please reach out to your direct leader. I love that they call him your direct leader. Find your leader. Or we have this employee service call center. So I just thought we could show you really, really quick. So I looked up all of these people's salaries. We'll pull up one of them. I think she makes like $200 and some $1,000, which is not nearly as wild as the CEOs, but we don't even have to look up. But I'll link it down below if you want to check it out. But they all make well over $200,000. This is interesting. So, Mr. Midwife, it's very bitch, this vibes. This union is really making it difficult for me to control my minions. It really is. So here's how you can walk out. If we're looking at our gaslighting bingo, I think we probably have, shifting, a little bit of shifting blame going on. We have saying like, hey, isolation, you can do it. You can get out there. Minimizing thoughts and feelings. If you like, you silly person, how dare you be wanting to do this? Why don't you come do this? Using what you love as a weapon. You love your job, don't you? Don't you know you can come to work? You don't have to have these 3 days off. So this one even didn't have, I will say this one did not have a ton of gaslighting in it. It just had a very odd tactic. So we can't really go after it too much for gaslighting. Yikes. Diary If a Union Buster is a great book, y'all. Oh, Diary of a Union Buster. Thanks, Adrian, for the recommendation. I will, hang on, leave that down below. Diary of a Union Buster book rack by Adrian. I'll find it and I'll link it tomorrow, not tonight. I have to go cook after this, all the other things. So that's what we're looking at. So their tactic was basically to be like, did you know your union is mean and you can still leave? Did you know? Nurse Adrian said we had one unit cross, one nurse on my unit cross, and then kiss ass. And then guess what? He got fired eventually. Bye-bye. It won't go well for you usually as a nurse if it won't go well for you if you're crossing a picket line. Adrian, my cousin had his wife had a baby, and I don't know what to do with people when they have babies because having a newborn was easily the worst time of my life, both times. Just very, very dark. Did not like it. And I was very overwhelmed. It's like you never sleep. And so then you're in this weird thing. So I don't know what to do. And I hate making myself food. So the only time I will cook is when I feel bad for other people and I'm trying to make their lives easier. So they might like to cook. Like they might not want this, but I'm showing up at their house tomorrow with a lot of food. It's not what they asked for, but it's what they're getting. So these poor people are going to have to at least accept my food and pretend that they ate it. But that's what I'm doing. I'm cooking all 7 things I know how to make. So that's what I have going on. That is what that's what we have going on. We have another email from the same hospital, but different people. Different people, my friends, because everyone was emailing. Also, Adrian, I appreciate you. You're like, cook? Yeah, I don't cook, friends. I don't cook. I don't cook, but I can hold other people's newborns. I love other people's newborns. I'm like, I will hold your baby all day long as I can go home and sleep. Do my children let me sleep through the night? No, but they only wake me up once or twice, which is so much better than when they were a lot younger. And it was all the time. Yikes. If you have a newborn, it's going to get better. It gets so much better. 5 and 3, fun ages. Everyone poops on the toddler years. So much better than the baby years. So much better, in my opinion. Okay, Fairview CEO. So this is the CEO. The CEO, in case you were curious, remember made millions. I think 2.3 million or whatever, just for fun, just to keep that in the back of your mind. Dear colleagues, I consider it a privilege to serve as your CEO, as your leader, as the other email would say, of Fairview Health Services. To be your colleague. We're definitely colleagues. That is what I think of when I see you, James. I'm like, yes, we're definitely colleagues. And to be a partner, your partner in serving our community. I don't get the partner energy though. I don't get that vibe. I just don't. I feel like you kind of live up here and we all live, where's my hand? There. And we all live down here. So that's just me. Each and every one of us, no matter where in the organization we serve, plays an important role in ensuring the health and wellness of our patients and families. It's all about the patients and families. Working in healthcare can be both rewarding and challenging, and even our best days can be exhausting. But it's the mission. It must be very tiring to make all of that money and think, how am I going to spend all of this? Anyway, but it's the mission. The service to others. Oh, sorry. That is a calling. And the reason why we do this work every single day. So immediately we're coming in hot with the gaslighting. Okay. So we're using a lot of using what you love as a weapon. So like, don't you love your job? Don't you love these patients? I love them too. And making it a lot of, like I'm on your team. We're all in this together. I don't know which one that would be. Denying wrongdoing. It's not my fault. It's not my fault as the CEO. This is, we're all in this together. We're all in this together. Let us continue. Like you, service has been part of my core since the very beginning. Like you, servant. That's the vibe I get. Like you, I too was once a peasant. Is the vibe I get from that. Like you, service has been part of my core since the very beginning. I was the first in my family to attend college, growing up the youngest of 6 kids and the child of Depression-era parents who made their living in ranching and livestock. I started my career as a high school math teacher and a basketball choice, a coach I made because of my interest in math coupled by the opportunity to be a teacher, a profession I admired. Do we have, I think I am God's gift to earth on the bingo card? No? Well, shifting blame. We could go with that. Denying wrongdoing, obviously. I'm the best. We should have had that one on there. Distraction. This is very distracting, John. This is very distracting. But yes. Well, I'm glad that you grew up and you were not necessarily born into $1.2 million, John. I will give you that. I have no idea what it has to do with any of this, as None of us were either. So this is, but now you do have 1.2 or millions of dollars. So I'm not vibing with you. I don't get your point here. As a teacher, oh boy, I served on the, oh no, I served on the union negotiation team. I put this in here, but I didn't read it yet. I probably should have. I served on the union negotiation team in my school district, representing my fellow teachers. We worked hard to get fair wages and benefits. We also diligently worked with the administration to understand the unique set of circumstances they faced. Ultimately, we came together collaboratively to solve problems and to create a work environment that teachers and administrators found to be fair. We came together because we shared a commitment to our students and also in creating a positive environment for learning and growth. We never lost sight of what mattered the most. So here basically saying, I've been on a union, friend. I've been on a union as a teacher, but I understood when we met with the administrators, just like you're trying to meet with us, like we were reasonable. Okay. We tried to see it from both angles and we wanted to keep all of the energy focused on the kids. You don't want to keep all the energy focused on the patients, but it would be really nice if you did. So like, why can't you be more like me? A very kind and understanding human. Why? So this is a whole lot of minimizing your own thoughts and feelings. It's why are you thinking of yourself so much? It's not about you. It's not about you, Betty. It's about the patients. Okay. Don't you care about them? I know you love them. They are your people. That's still not bingo. I'm not doing anything wrong. Kind and loving words is a weapon. This one would also go with before when he was like, we're all in this together. I know what it's like to be you, right? I'm doing this out of your best interest. That's kind and loving words as a weapon. I'm doing this for you. Okay. Because I know you want this. I know you want this. So that's creepy. And I hate that. There is more that unites us than divides us. We're not alone. We're all in this together. We are here to serve our patients. I changed careers because I found out I could make a buttload more money as a healthcare administrator. Oh, that's not what it says. I changed careers because I fell in love with healthcare. I bet. I was moved and motivated by how every single person I met was driven by the mission and deeply dedicated to patient care. I want to vomit in my mouth. I think what he meant was I was moved and motivated by how I could make 25 times more money than I could as a teacher. I think he missed that one just a little bit. As we face the prospects of a strike in Minnesota Nurses Association, I think he meant let me be clear, but he was a math teacher, so we'll forgive him because he said, let me clear. It's fine. Our nurses are a critical part of our team, and it takes an entire team from the front lines to the back office to serve our patients. Wow. Thank you for telling me that. I did not realize. I am continually awed by the professionalism, care, and caring. Wow. He really was not an English teacher. I am continually awed by the professionalism, care, and caring exhibited by each and every one of you. Okay, James, I just need you to come up with 3 adjectives for the nurses. Okay. Professional, caring. You already said caring twice, James. You said caring twice, James. I just needed 3. Care. That's fine, James. That's fine. Let's just sign off the email. It's fine. They're not technically the same word, so it's fine. So that's good. So we're caring. When the strike is over and we settle the contract, good. Which we inevitably will. Yes, you inevitably will. One day you have to come together and come up with a contract. That is how the law works. All of us must welcome our union represented nurses back with warmth and grace. So they're sending this to the nurses. It sounds like now he's switched into a pep talk for himself. When a strike is over, the strike, are you going to have more? When a strike, I think this last part here looks like it's like from a handbook of like how to be a manager, right? When a strike is over and we settle the contract, which you inevitably will, all of us must welcome our union represented nurses back with warmth and grace. It's all the nurses, John. Are you talking to yourself? You have to be kind. Are you sending out an email to remind yourself that you have to be kind to people who were standing up for their own employment? That's weird. Yikes. Because ultimately, we cannot lose sight of what matters most, caring for our patients and serving our community. with gratitude. I don't think you're grateful, James. I don't think you're grateful that you're having this interaction with us right now. But that's just me. Maybe I'm wrong. Oh, James. Okay, so we have a lot of denying wrongdoing. This is not me. This is you. I was in a union once. You're doing it wrong. Um, like weird. Look what you made me do. Type of look what you made me do. Use love as a weapon. We should care about our patients. You should not care about yourself. You should do this. And using kind and loving words as weapons, even if he could only come up with two of them. So, do we have bingo? I don't know if we have bingo here. Someone let me know if you think we have bingo. But there is our Fairview. There's our Fairview. That is sounds like a pack of lies. It does sound like a pack of lies. Let's just say I think we pretty much did get bingo. So if we have lying, denying wrongdoing, did he project? Yeah, because he was talking about his own time and eliminate our self-confidence. I'm sure he did that. Well, I don't really care. We're gonna do this. Because I wanted to. So bingo. We'll say that you, Fairview CEO, you won bingo. So that's exciting. We have one more, um, one more that we will review, and then we'll do a quick Q&A, and then I'm going to go cook food. He's running out of words. He really is. He's like, oh no, get a thesaurus. Like, how hard is it? How hard is it? James or John, whatever your name was. James is kind of dumb because he should have stuck to the high unpaid labor union buster lawyer script. He really should. Oh, fancy. Why, thank you. This was really fun. Thanks. We have one more. And like I said, if you ever would like to be in charge of bingo or have something to contribute to bingo, I am more than happy to play gaslighting bingo whenever we would like. Give it up to the hardest working person in the hospital. Flawless email right there. Absolutely flawless. Let's see. Our last one is from Essentia Health. This is a different hospital. Dear hero who accidentally dropped this email into Liz's inbox, I am writing with important updates. This is the whole C-suite is sending this. So this is the president, the chief operating officer, and the chief nursing officer. The CEO did not have time to write down this email, so he's not here. I am writing with an important update on the negotiations between Essentia Health and the Minnesota Nurses Association at Essentia Twin Ports. We are privileged to work with some of the best nurses, medical teams in the country, and we believe our nurses are essential to delivering our mission of making a healthy difference in people's lives. All right, so we've got some pretty strong, talking nice, using kind and loving words as weapons. We've got that going on so far. Recently, union members voted to authorize the MNA to call a strike. No, duh, John. This person probably voted in that. No, duh. We strongly believe in our shared responsibility to provide quality care to the patients and communities we are privileged to serve. So here they're trying to level with you. They're like, it's not just you. We also are trying to provide care. We're also trying to buy yachts, but we're also trying to provide care. Okay, we're the same, Betty. We're the exact same. To help continue progressing in negotiations, we wanted to share with you some of the common ground positive results already accomplished at the bargaining table. Below are some of the areas the parties have reached tentative agreements. Casual status. I don't know what that means. Holiday scheduling. Good. I'm glad you will be giving people holidays. You have figured out what holidays they must work and a schedule around that. So at my union hospital, you worked every other holiday. You got to pick your holidays by seniority. You picked like a couple winter holidays and a couple summer holidays. So this does not even mean anything. This literally means they came to an agreement of how they would pick holidays within the hospital. Wow. You've also figured out dual licensure. So what are you going to do if you have someone who is licensed as a nurse practitioner and a nurse? Can they practice at your hospital? Because some places say, well, if you're an NP, you can't be a nurse here because technically they could come after your nursing license and you could be held to a higher standard. So they figured that out. Great. Non-discrimination policies. Wow. Look at you go. You have figured out how to hire people who don't look like you. Kudos. Good job, John. And low needs days. What are you going to do when you have to offer people time to go home, which is never a problem because hospitals are almost always full. So you've figured out probably a on-call list. That looks like none of the things that they wanted to accomplish. So this is going to be a BS list. So good job. I'm glad you've really figured out a lot. You can see the people who are like writing this email. They're like, what have we done? They're like looking at this list. They're like, this is not a good list. We're just going to have to put it on here. Do we do anything constructive? No. Okay, good. They're like, but we really did have some good sandwiches the other day. Anyway, we believe Essentia Health is a vital asset for our community. We are important. Good. And a big part of what makes the Twin Ports a great place to live, work, and raise a family. So if you don't come to work, you are making it a bad place to have a family and literally harming our entire community. That's what I read there. We continue to focus on providing a safe and healthy workplace and offering a competitive wage and a benefits package so we can attract and keep great nurses who choose to make this community their home. They still pay $10 to $15 less than the competitors. So hello on Gaslighting Bingo, we say everyone else is lying to you because they're saying, we're doing a great job. You're getting paid really well. No, that's a lie. Rewriting history despite proof. We have proof, John, that this is not true. You make less. Minimizing thoughts and feelings. We might immediately get bingo. Minimizing thoughts and feelings because how dare you think that you have it badly when we give you such nice benefits and some money to come to work? How dare you? Rude. Very rude. There are a few, we've covered these major issues already, as we've outlined below or above. We've talked about what are we going to do when we have too many nurses, which has never happened in the last 3 years, but it's fine. Holiday schedules. Will we hire people who don't look like us? And can you have 2 licenses? We've do have a few substantive issues other than that we have to work through. I know that shocks you. I know. And in case of wages, the 2 sides remain far apart. Oh, that's interesting. But you're able to solve so much. So I'm just shocked. Our most recent proposal continues the current benefits and would provide a wage increase of 10% over 3-year term of the contract. This is a wage proposal that is more than agreed to during our last negotiation. So we're doing better than we did last time. Okay, we're not doing what you want, but we're doing better than we did last time, and you should give us credit for that. Just because you're not as awful as you usually are, John, does not mean that we cannot have concerns. Okay? That's not how this works. The M&A, this wage proposal is more than was agreed to last time. In contrast, the M&A is seeking a wage increase of 32.5% over the same time period, plus enhanced benefits and increased differential bonuses. So you ungrateful swine want all of this. Rude. You're not being grateful at all that we have already offered you all of these other things. So they're upset. I don't think we have bingo yet. We need to eliminate self-confidence, but we do have a lot of look what, you made me do energy going on, denying any wrongdoing, shifting the blame because it's all of our fault. They've already lied. So all they need to do here is incite chaos. Essentia Health is doing a really good job at this bingo game. So they're saying, how dare you want the wage increase that would bring you up to market value? We've offered you something else. And you've declined it. So you're the worst. To help resolve these issues, we have asked the M&A to join us in requesting the assistance of an independent federal mediator from the Federal Mediation and Conciliation Services. A mediator has been engaged in previous negotiations and has helped parties come to mutually beneficial agreements. After repeatedly declining the opportunity to involve a mediator, the M&A is considering the request, to which we hope they will agree. So you need to go and send someone else to fight your battles, is what I'm hearing. That you can't do it. So, which is literally your job. Literally part of your job is to negotiate with the union every few years. This is not all the time. You can't do it. As in the past, we believe that our focus should be on providing quality care to our patients so our respective teams can keep their focus on the bargaining table where solutions are found. Focus all of your energy on this. Oh boy. So stop, going on your Facebook, stop going on your social medias, your TikToks, and talking about how bad we are and how bad you have it. You should really be focusing on the situation at hand, which is how you can serve your patients better. Okay. While we respect the bargaining process and the role of the MNLA, we believe no one wins in a strike. Well, while we respect that you are people with opinions, we just don't want to hear them. We don't respect it that much. We encourage you to visit the website and we have developed that we took all this time to develop and more money to develop to serve as a source of information as negotiations continue. You can find the website here and find out what else they might have offered. You know, I don't have any words since they've already come so far, as we saw. We deeply value and appreciate all your contributions to patient care, and we thank you for all your good work. You're so great. Except we hate you, is the vibe we get there. Good. So Essentia Health, you certainly incited chaos when you wrote that email. So I think because inciting chaos just makes you like off your guard. And so you're more likely to go along with whatever because you're just like, oh my gosh, I just need a solution. So congratulations, Essentia Health. You have won gaslighting bingo. So perfect. Perfect. So this is inciting chaos is my favorite. Yes. Yes. It's mine too. And when I read that, I was like, that makes so much sense. I feel like that is the tactic my children have with me is they incite chaos to wear me down so that like at the tiniest sight of like any stability, even if the stability is something I don't even want to do, I'm just like, that's it. I'm going to cling to that because you've incited so much chaos that the option isn't good, but it's an option. So that's where we are. What a horrible letter. Yes. What a horrible. Rogan P said, we're nurses. We can multitask like no other. Exactly. Don't you tell me where to put my focus. Don't you tell me. Matthew Ives asked Nurse Adrienne, any idea why they push for these letters? I don't know. I don't know. Montana Gal will avoid working for Essentia. Perfect. Thanks, Adrienne, for being my hype woman. I appreciate you. Nurse Adrienne said they are notified when impasse in bargaining is imminent and can be used. However, their goal is the parties settling. So basically they want to settle it, right? They don't want it to come to this. They want everyone to like saying, yes, we want to strike and we approve it. When the nurses do that, that's their final like, hey, you really need to get your ish together. Because if not, we're going to throw down the hammer. And now they're throwing down the hammer. So that's what we've got going on. That's what we got. He hurt thousands of employees to impress. I missed whatever started this. Nailing bingo. Ascension. Yeah, Ascension. They really did a good job. Nurse Adrienne said, if you don't keep wages up with inflation, you're actually losing money. It's a compounding loss and gain over time. Exactly. Which is why the nurses wanted the raise of like 30% because they haven't been giving it to them. And so that's literally just bringing them up to market value with the other hospitals in the area. Let me see. It does sound like an abusive relationship. That's why I decided to put it as gaslighting, because gaslighting is a very, very abusive tactic that you can see in a lot of like relationships, even if they're not romantic. And we have a very abusive relationship thing going on in this employer-employee relationship. CK Medic said, I had a really bad experience with an EMS unit after we were voted in. Don't get me wrong, the company was also horrible. But we ended up getting it bad from both sides, and that does suck. There are definitely, all unions are not created equal at all. Wow. Great work, VP and CEO. Yeah, they really tried hard. Adrienne corrected, sorry, book is a confession of a union buster. Perfect. Confession of a union buster. We will update that. Confession. How dare you not have the free information you're very valuably giving us? Perfect on the first try, Adrienne. Rude. So there we go. Look at what we've accomplished so far. We're going back a little. I'm reading the comments now. Pat on the back, everybody. We've accomplished 5 useless things that should not have even had to be negotiated because they already should have been in place. Good. Good news is I got my $5 million bonus. Don't play chickens with nurses. Yes, exactly. Lisa, the housekeepers are not involved in this. They are apparently in their own. Hang on, need more water. They have their own union apparently. And they are supporting the Minnesota nurses, which is great because their life's about to be held this week, and I feel bad for them. Adrian said, let's take some bets on which executives loses their job after this strike. You will not be getting a pizza party. No more pizza parties for you, John. You're going to have to buy your own pizza. You can also, Adrian said, order food to be delivered to the strike lines. I like sieved though. She did explain that sieved is a typo, but I really like sieved. I just imagine people like putting it down a giant cone, like, here you go, sprinkling it. Perfect. Another great book recommendation is U.S. History in 10 Strikes. Thanks, Adrian. U.S. History in 10 Strikes. Perfect. Sorry, I know it's past my bedtime. It's past mine too. I'm going to be up so late tonight. It's going to be fine. It's perfect. Minnesota nurse here. Stephanie, excellent. Let us know if you're part of this or if you're just supporting Minnesota nurses or what you're up to. Let us know. Yay, Minnesota nurses. We like those. So yeah, that is what we have. We have played bingo. We have reviewed the emails. I think that's all we've got going on. If anyone has any questions, we have 6 minutes. And then I'm going to go make a chicken salad sandwich. I have to pack up all this food. And we're going to go to bed eventually. Probably by the time I get to bed, my own children will be awake and they'll come in and they'll want to snuggle. But thanks for hanging out tonight, friends. If you are not hanging out for the rest of like any kind of Q&A chit chatty time, I appreciate you being here. What were we going to say? I'm supposed to tell you to like the video an odd number of times, do compressions on it to raise its vital signs. That tells the world that you should also watch this video. Subscribe, talk to everyone you know about union or like this and about supporting the nurses because they're going to get a bad rap. It's going to be rough. A rough time overall. So just kind of like showing support. It sucks and it's hard. It's got to feel really rough not going into work knowing it's going to harm your patients, but they're using that as manipulation against you. You know what I mean? So just like supporting them, being like, hey, we know you're doing this. Like this is ultimately for the betterment of the patients. This is great. Stephanie Pajari said, I left the hospital system 6 months ago. Go you. And I'm a corrections nurse now. Do you like that more? Joining my friends on the line this week, though. Awesome. Awesome. I've heard a lot of people like corrections, that you have a lot of autonomy. Just don't do it in North Carolina, where apparently you will go to jail for other people doing horrible things to people. Matthew Ives said, thanks for putting these on. Oh, you're welcome. I suppose I should go back actually doing my homework. ATI, yuck. That sounds awful. Good luck. Best of luck. Godspeed. Montana gal, can't wait to see you again. Oh, thanks. I feel the same way. Thanks for always being here. Tuesday, we're going to be discussing, probably on Tuesday Night Lives, the stupid prep thing that came out where they're like, we just won't do that. You don't need that. It's fine if you die. We're not loving that. Jennifer Jordan, we're trying to organize in Kansas. Do it. Adrian said, yeah, not in North Carolina. Yeah, we also just had a thing about in North Carolina where they're doing interesting other laws where they're basically, we kind of broke down that if you've heard from North Carolina, the Supreme Court made a decision of that nurses could be held liable, but they wrote it so loosely that it's mildly frightening. What time on Tuesday? We usually do 8:30 in the evening on Tuesdays. Thanks, Sophia. And then we will be switching this week to not Thursdays, but I think Fridays, for our group panel discussion, which I have no idea what that will be on yet. Eastern time. Yes. So usually on my channel, we do Tuesday nights, which is Late Night with Liz at 8:30 p.m. Eastern. And then on Friday now, because preschool is changing my life, we will do at like 3:30 p.m. So more of an afternoon chat. And that we usually have a lot of these lovely humans who you've seen in this chat, Adrian, Chad, Scott, Cal, Mama Nurse, all sorts of lovely humans who drop into that. And that's more of like a community discussion. So you can hear a lot of other opinions and people who disagree with me, and then people who agree with me. Because, those kids, I swear, I know they're like taking over my life so much. But they're lucky, they're cute. And they draw me pictures like this. And then, cause I'll be like mad at not directly from this, but like they'll do things and I'm like, oh my gosh, like what is my life? Like what is happening? They are literally taking it over. And then they deliver things like this to my office, which is me. This is, in case you can't tell, this is a picture of me. I am a heart because they love me. Avery made this. And I'm wearing blue because blue is her favorite color. And it's sunny. And that is a bird. So then they make me things like that. And I'm like, well, you can stay. You're very cute. And that's the best. So we keep them around. All right, friends. Thank you so much for being here. Hopefully we will see you later on in the week. Always remember that you, my friends, are more than enough. Do not let anyone gaslight you. No. Remember those things on there. If you see those happening in anything in your life, leave. That's not a sign of a good relationship. You're more than enough. You, my friends, are not alone. You have all these other people here with you. We're all going to get through it. And you can do hard things. I'll see you next time, my friends. Goodbye. Good night. Yes. Scott, when he is not later available. Scott, I mean, he's going to get kicked off of the squad if he keeps up this behavior of missing these non-mandatory attendance activities. Goodness gracious. I need a copy of the gaslighting bingo card. I'm going to figure that out. And when I say I will, my sister will. That's what I mean by that. Avery is going through a blue period. Her favorite colors are red and blue and sparkle. It's like, perfect. It's her first day of preschool tomorrow. Everyone cross all of our fingers that it goes okay. I'm dropping her off, which never goes well because when they cling to me, I cling back. Joe just is like, hey, you have to leave. But when my babies cling to me, I'm like, yes, stay. Stay. Oh, it's going to be fine. All right. Well, that was a good Midwestern goodbye for our Midwestern video. Have a lovely evening. Where did this comment go? There we go. Like, how do I get this off my screen? Bye for real. Bye-bye now. Oh, bye-bye now.